the hard-earned benefits of workers, retirees, and their families. The Employee Benefit Security Administration, or EBSA for short, oversees retirement, health care, and other employee benefit plans. Altogether, EBSA helps support the health and financial security of over 153 million Americans. Yet despite EBSA's vital mission and its growing responsibilities, it has consistently been underfunded by the majority. Since 2013, the number of staff hired through its base appropriation has declined by more than 25%. And as a result, EBSA has increasingly relied on unpredictable supplemental appropriations to perform its basic functions. Unfortunately, supplemental funding is set to dry up soon, with the bipartisan No Surprises Act implementation fund expires at the end of this year. This will cut EBSA's workforce by as much as 14%. To add insult to injury, House Republicans have proposed to cut the agency's budget by an additional $10 million in this year's labor HHS appropriations bill. This is a crisis for workers, retirees, and their families, and should not be a partisan issue. Cuts in EBSA undermine the bipartisan progress we have made in recent years through the No Surprises Act, the Secure Act 2.0, and so many other important laws. So I hope today's hearing will give us an opportunity to discuss the need to address these funding shortfalls while recognizing the incredible work that EBSA, under Ms. Gomez's leadership, has managed to accomplish with its limited resources. You've all heard me discuss my history as both a union member and a business owner, and I've been able to see both sides of employer-sponsored health care and retirement plans and the ways that they can make or break a workforce. EBSA does an enormous amount to protect and serve workers so that they and their families can have security and stability. In the past few years, EBSA has made great strides in protecting benefits and putting money back in the pockets of working Americans. Last year alone, EBSA recovered over $1.4 billion in payments through enforcement activities, informal complaint resolutions, and other actions. The agency has also recovered $6.7 billion in retirement savings for missing participants since 2017. And every day, Americans get assistance from EBSA's benefit advisors who help workers navigate the complex issues with their plans. EBSA is also taking crucial steps through its regulatory efforts to make life better for the American people. In April, the department finalized the Retirement Security Rule, which will ensure consumers get financial advice from conflicts of interest. Morningstar concluded that the rule would save over $55 billion in the first 10 years and over $130 billion in the subsequent 10 years. EBSA is also working diligently to improve health coverage. Last fall's proposed rule on mental health parity is a huge step forward in improving access to behavioral health care for millions of Americans. The agency has also worked to reverse harmful actions taken by the Trump administration to expand junk health plans, such as short-term, limited-duration insurance and association health plans. There is still even more work to be done. In recent weeks, for example, Ranking Member Scott and I have encouraged EBSA to take steps to improve transparency in claim denials and collaborate on ways to improve parity in long-term disability plans. However, to ensure that EBSA is equipped to move forward on these and other priorities, including many bipartisan ones, we must all commit to giving the agencies the tools and resources it needs to do its job. Thank you, Mr. Chairman. I look forward to a productive discussion of these issues, and I yield back.
Thank you to our ranking member. Pursuant to Committee Rule 8C, all members who wish to insert written statements into the record may do so by submitting them to the committee clerk electronically in Microsoft Word format by 5:00 p.m., 14 days after the date of this hearing, which is July 11, 2024. Without objection, the hearing record will remain open for 14 days to allow such statements and other extraneous materials referenced during the hearing to be submitted for the official hearing record. We will now turn to the introduction of our distinguished witness. We have before us today the Honorable Lisa M. Gomez, who's Assistant Secretary of the Employee Benefits Security Administration. We We thank the witness for being here today, and we look forward to your testimony pursuant to the committee rules. I would ask that you limit your oral presentation to a 5-minute summary of your written statement. I'd also like to remind the witness to be aware of her responsibility to provide accurate information to the subcommittee, and we now recognize Ms. Gomez for 5 minutes.
Thank you, Chairman Good, Ranking Member DeSaulnier, and members of the subcommittee. Thank you for the opportunity to testify today about the important work of the Employee Benefits Security Administration, or EBSA. I am proud to appear before you today to highlight the invaluable services of this small but mighty agency and what we provide. EBSA's mission is to protect the hard-earned retirement, health, and other job-based benefits of America's workers, retirees, and their families. We do so by developing effective regulations, guidance, assisting and educating workers, employers, plan sponsors, fiduciaries, and service providers, and enforcing the law. EBSA oversees more than 765,000 retirement plans, 2.8 million health plans, and 619 other benefit plans, collectively holding about $14 trillion in assets. ERISA-covered benefit plans cover more than 153 million workers, retirees, and their dependents. And EBSA also has regulatory and interpretive responsibilities related to individual retirement accounts that cover another roughly $13.6 trillion. EBSA's current limited resources place our mission at risk. EBSA's staffing is minuscule compared to the obligations that Congress has placed upon it. EBSA currently employs less than 850 people nationwide and has less than one investigator for every 13,900 plans. Even with those limited resources, in the last fiscal year, EBSA recovered over $1.4 billion for plans, participants, and their families. Almost $845 million of those recoveries resulted from our investigations. In one case, EBSA recovered over $230,000 in contributions owed to a plan that covered participants who only spoke Spanish. We worked tirelessly to locate those participants, and one participant's wife was in an emergency clinic with her husband when we called to tell her that they would be receiving $31,000 from his retirement plan that was recovered for him. She said that recovery was a miracle. EBSA's benefits advisors answer questions and help workers and their families navigate benefit issues. Last fiscal year, they recovered $444 million in benefits owed to workers and their families, and in some cases, helped accelerate coverage of life-saving treatments. One person called EBSA because his health plan denied pre-certification of a heart transplant. Without that transplant, he only had 6 months to live. Without the plan's approval, he couldn't be placed on the waiting list for the heart. EBSA intervened, the plan approved the procedure, and he received the transplant. He said that EBSA's work was nothing short of a miracle for which he is forever grateful. These are just 2 examples of countless stories in all of your districts that I could share about how EBSA helps real people in real ways every single day. EBSA's top priority is mental health parity. Through our proposed rulemaking and our dedicated enforcement efforts, we hope to increase access to necessary treatment for families living with mental health conditions and substance use disorders. EBSA is also working on implementation of the No Surprises Act, which has eliminated 1 million surprise medical bills every month for people who might not know that their provider is not in their health plan's network. We've devoted time and resources to implement the Secure Point 2 Act through regulations and guidance to increase access for American workers to retirement savings and implemented a new initiative to support the creation and expansion of worker-owned businesses. We published the final retirement security rule, which stands for a basic position that when investors look for trusted professionals about managing their hard-earned retirement savings, they deserve prudent advice in their best interest, free from misrepresentation and overcharges. In conclusion, I'm proud of the accomplishments we've achieved, and I hope Congress will provide us with the support, tools, and resources we need to continue to do so. And with that, I thank you again, and I look forward to your questions.
Thank you. Under Committee Rule 9, we'll now question witnesses under the 5-minute rule. I will wait to ask my questions and therefore recognize Mr. Wahlberg from Michigan for 5 minutes.
Thank you, Mr. Chair, and thank you, Assistant Secretary Gomez, for being here. EBSA pushed DOL's new final rule on fiduciary duties through the rulemaking process with a relatively short comment period, to say the least, even though the rule was economically significant. The public had little time to prepare for participating in public hearings. You justified this by stating that DOL already heard from the public during prior rulemakings, including for the 2016 fiduciary rule that was invalidated by the U.S. Court of Appeals for the Fifth Circuit. Is it your position that the public engagement during the 2016 fiduciary rulemaking allowed DOL to write a rule 8 years later without robust engagement?
Thank you, Congressman, for your question. The retirement security rule is a critical rule for the Department of Labor and for the Employee Benefit Security Administration. With respect to the process that we engaged with on the rule, we engaged in a 60-day comment period. And during that comment period, we received 400 comments as well as 20,000 individual petition submissions. And as Congressman, you mentioned, this has been a long, ongoing process and discussion between stakeholders, the department, and there were, we received lots of...
I appreciate that, but that is the background of my question, because it wasn't in relationship to other rulemaking hearing proceedings. It was very short, especially since the 2016 fiduciary rule was invalid by the U.S. Circuit Court of Appeals, U.S. Court of Appeals. Let me just ask it this way. Did you and do you believe that the 2024 final rule is similar enough to the 2016 rule to shorten the process? Because it was shortened.
In two different ways. There are, well, two answers to your question, Congressman, and thank you for that clarification. With respect to the comparison to the 2016 rule, we took a very close look at that 2016 rule and made many changes in our proposed rule to take into effect what we had heard from the courts, what we had heard from stakeholders in the interim, and changes that had been made to the regulatory landscape. When we issued the proposed rule, we felt that we had a rule that had acknowledged and reflected those many changes. In issuing the final rule, we took into consideration what we had learned over the years from stakeholders, as well as what we had heard through the notice and comment process, as well as what we had heard through 2 days of hearings from interested parties. And we made various changes to the final rule based on that feedback.
Referring to the stakeholders, earlier this year, this committee held a hearing with industry stakeholders, examining the impact the rule would have on everyday Americans. That's our specific interest. In response to one of my questions during that hearing, the witness representing state insurance commissioners stated that DOL had no substantive contact and no coordination with their industry in the development of the new rule. Additionally, the National Association of Insurance Commissioners stated that DOL discounted the work of the states to enhance consumer protections. And so, can you cite in concrete terms the coordination that DOL undertook with the states, which are the primary regulators of annuities?
Yes, thank you for that question. I would be happy to do so, Congressman. We had meetings with both the Securities Exchange Commission and the National Association of Insurance Commissioners, with whom you reference. And we engaged in discussions with them. We received their comments. We offered additional meetings with them to discuss the proposed rulemaking after it was issued. They did not take advantage of those comments. Nevertheless, we did make changes in the final rule to more greatly accommodate, in particular, some of the disclosure obligations that the NAIC requires, so that they would be more in line and less burdensome.
Well, my time has expired, but they're concerned with there was no substantive deliberation with them, and I think that is our concern. So we will continue checking in. I yield back.
Thank
and
you.
I would be happy to provide more information.
Thank you. We'll now recognize Mr. Courtney from Connecticut for 5 minutes.
Thank you, Mr. Chairman, and thank you to the witness. It's good to see you again. Just about a year ago, you came up to Eastern Connecticut, and we had a series of meetings on issues regarding ESOPs, the worker-owned businesses, as well as the mental health parity rule. And I would just say your command of this subject matter was really so impressive and very accessible, and I would encourage any of the members to invite you up, because obviously the breadth of your portfolio is something that is really huge and affects so many people on a really personal basis. So it's great to see you here again. Regarding the ESOPs, again, in the 2023 Omnibus, a bipartisan measure was passed to, again, get the Department of Labor, in particular your office, in a position where you could help businesses who are interested in converting to ESOP, employee stock ownership plans, the opportunity to really get upfront a lot of good questions answered and, really run the traps so that a decision like that can actually happen more smoothly. And given, again, the rise of ESOPs around the country, clearly there's an appetite out there for that as a way of solving legacy issues for company ownership, as well as providing greater employment security. So could you talk a little bit about what the department's been doing since, again, Congress acted to expand the Department of Labor's role?
Yes, Congressman Courtney, and again, thank you for that opportunity to be able to come to your district and to visit with, I think that was the first ESOP that I had a one-on-one visit with, and was able to hear directly from employee owners about how it has benefited them and what they would like us to consider in looking forward to implementing the Work Act. With respect to the Work Act, as part of Secure 2.0, we at EBSA were very delighted to take on this additional responsibility, which is mainly twofold. On the one part, dealing with setting up an employee ownership initiative within the Department of Labor, which we did pretty swiftly, about 6 months after the Work Act through Secure was enacted. We set up the Employee Ownership Initiative within the Department of Labor and our Division of Employee Ownership. We've been staffing that and have a chief that will be starting any day now. And regarding the visits to the ESOPs, those visits have been just so incredibly important to my learning about how they work, how employees benefit, how they can be an integral part of retirement planning for workers. And I have been embraced, I would like to say, by the ESOP community, who has been really just thankful to have someone who is coming in and trying to genuinely learn about all of the advantages that can be gained from that system. Parallel to that, under the law, we are required to issue formal guidance on adequate consideration and valuation of employer stock in the context of ESOPs. We have committed to, because ESOPs are retirement plans at the end of the day, And we are committed to issuing final notice and comment rulemaking, which we are hoping to do very shortly, and to engage further with the community to get information on how to best offer these types of programs.
Well, thank you. I mean, as you and I discussed, I mean, this was an initiative, the Work Act, which the ESOP community had been pushing for a number of years. And the fact that, again, now the Labor Department has embraced that role, I think is something that's very welcome, and really look forward to supporting it. It was, however, a new sort of portfolio for the department, and as Mr. DeSaulnier stated in his opening remarks, again, it requires people and staff, and so having a budget cut that was just announced yesterday afternoon to your department, which again has taken on the surprise billing initiative, with another bipartisan measure that many people on this committee were patting themselves on the back in terms of enactment. But again, it can't happen by itself. We need to really robustly and fully fund your department. And it's not a frill. This is about really protecting people's access to health care and their retirement security. So thank you for your great work. And with that, I yield back.
I appreciate that.
Thank you. We'll now recognize Mr. Allen from Georgia for 5 minutes.
Thank you, Mr. Chairman, and thank you, Assistant Secretary, for appearing today for our committee to continue the conversation about the fiduciary rule. It's already been proven the failed recycle policies of the DOL fiduciary rule harm the very people it claims to protect, retirees and savers. According to a Deloitte study, more than 10 million lower and middle income individuals lost access to investment assistance during the short time of the Obama-era 2016 fiduciary rule. Fortunately, the Fifth Circuit Court rescued the American people from that terrible rule and invalidated the rule. So it's clear that your administration has deliberately chosen again to ignore what's best for the American people. This is why I've introduced 4 Congressional Review Act joint resolution of disapprovals in the House to disapprove the 2024 fiduciary rule. These 4 CRAs will rescue the American people from the Biden administration's overreach in this matter. Madam Secretary, did the DOL consider the loss of investment advice the fiduciary rule would cause to these individuals?
Thank you, Congressman Allen, for those questions. The Department of Labor, certainly as part of looking towards whether or not to move forward with the retirement security rule, considered a number of different effects, including what the effect would be on small savers, on underserved communities. And
what steps did you take to ensure that fewer individuals would actually be harmed by this rule? I mean, what did you actually do?
Sure. Well, at bottom, the rulemaking requires that people who are holding themselves out as trusted advisors are going to adhere to basic standards of fair dealing when it comes to dealing with retirement investors. That if anyone, whether they're a small saver or a larger saver, that when they seek recommendations from a trusted professional about how to invest their hard-earned retirement savings, that those retirement professionals, their advice need to be prudent. They need to be in the retirement investor's best interests. They need to not be misleading and not have overcharges. And those protections are important.
So who decides that? Does the government decide that now, or do the peer groups in the industry decide it? You know, these are all certified professionals.
Well, thank you, Congressman. They are not all certified financial professionals, and they are not all necessarily professionals who claim to be or put themselves out as fiduciaries. Some of them do indicate that they will provide certain responsibilities and duties that they are not, in fact, legally required to provide. And
so the Department of Labor is going to decide then who is certified and who's not?
Thank you, Congressman. The Department of Labor is not going to define who might be certified.
Okay.
The Department of Labor will, however, decide whether in providing advice in a certain manner.
Well, this rule is going to do much harm, and I need to move on here. Under your watch, EBSA mischaracterized and misled the public about the Trump ESG investing ruling, which required that a fiduciary, including an investment manager, perform his duties solely in the interest of the participants and beneficiaries and for the exclusive purpose of providing benefits under the plan. Your administration encourages financial institutions to participate in left-wing activism and ideological preferences when investing Americans' hard-earned retirement savings. Last year, I introduced the Rollback ESG to Increase Retirement Earnings, or the RETIRE Act, which requires ERISA retirement plan sponsors to prioritize financial returns over environmental, social, and governance ESG factors when making investment decisions on behalf of their clients. Madam Secretary, why does the DOL continue to blatantly ignore ERISA and the Supreme Court ruling by allowing financial advisors to invest Americans' retirement savings into ESG funds, which are proven to carry higher risk?
Thank you, Congressman, for that question. The Prudence and Loyalty in Plan Investments final rule that was issued at the end of 2022 is very clear as to what the fiduciary responsibilities are with respect to plan professionals who are making decisions how to invest plan assets. And in that rule, we were crystal clear that fiduciaries may not subordinate the interests of participants and beneficiaries in their financial plan benefits to any other objectives. They may not sacrifice individual return or take additional investment risk to promote other goals that are unrelated to the interests of participants and beneficiaries.
I hate to cut you off, but my time has expired, and I'm telling you, there's a lot of confusion out there, and it's been created by your decisions, and it needs to be fixed. Now you'll
Thank you, Mr. Allen. We'll now recognize Mr. Norcross from New Jersey for 5 minutes.
Thank you, Chairman, and Ms. Gomez, it's good to see you, and I want to begin my questions today with a statement of how incredibly important not only the Department of Labor, but your department is to the American worker.
Thank you.
We kind of tend to forget that a little bit, that your single focus is to make sure that workers are treated fairly, get the benefits that they deserve and that they have earned. And that we can talk about all the nuances, and they're extremely important. But at the end of the day, it's about trying to make the American worker get his or her fair share and nothing more. So I just want to reset the field, because sometimes in this committee we kind of forget about that. Not all of us, but certainly some of us. So when we start talking about retirements and the Butch-Lewis Act, Ranking Member Scott, myself, and several others sat on a bicameral partisan committee for the better part of the year. At the end of that, nothing came out of it. And then the Butch-Lewis Act came, which literally $80 billion, saving the American workers' retirement, with not one vote for those who are saying we care about the American worker, not one vote from the other side. So let's remember who we're here for and why we're working that way. With that being said, back in 2008, the Mental Health Parity and Addiction Act was passed. This talks about treating mental health issues, addiction being one of those, the way you would as a physical injury or a broken leg. Because quite frankly, the stigma of mental health in this country, although moving in a much better direction, particularly back then, was horrific. People didn't talk about it. It was that dirty little secret. Yet people were dying left and right. Addiction was skyrocketing, and unfortunately still is. So the idea that our plans that are covered by your committee or your administration talks about you must by law treat physical and mental equally. We have one glaring omission on this, and in this room everybody can relate to it. It's called, the example is the speed limit going down the highway, says 55. If everybody here knows there's no police officers, there's no cameras, there's no enforcement, we know what happens. Nobody pays attention. And that's what happens currently when, yes, you are supposed to treat them differently, but unless you get caught, Nothing happens. And if you do get caught, you just have to pay what you originally had to pay. So there's no loss, there's no incentive to do the right thing here when the American worker takes the hit. So I have a bill that has addressed this, putting some teeth into this. Can you talk about the difference between having enforcement and penalties versus the world we're in now, where the only thing that happens is if you get caught, you have to pay for what you already had to pay for?
Yes, no, thank you, Congressman Norcross, and I want to say also thank you for your support with respect to special financial assistance that has protected over 1 million pensioners at this point, with more to come. So I sincerely appreciate that, and it's been wonderful to work with you on that. With respect to mental health parity, this is a subject that is critical not only for the administration and the department and the Employee Benefit Security Administration, but for me personally. This is a high priority, and as Congressman, you reference, we are working to address a mental health care and substance use disorder care crisis in this country. In order to do so, we need to have at EBSA the enforcement tools in order to be able to investigate and enforce when we have bad actors and folks who are not complying with the rules. Currently, we have very limited authority in this area. And one, as Congressman you mentioned, relates to civil monetary penalties. We do not have authority to assess civil monetary penalties. We have noted in our report to Congress that that is an issue that should be looked at. And anything that we can have to put teeth in this law to assist us, including having additional resources so that we are not so farly outnumbered, as I mentioned, when we are trying to go out there to find and address these problems, is sorely needed.
In my few seconds left, I just want to talk about the budget side of this equation, because A, you need the authorities. There's no question about this, that it will save lives, but it's also you have to have the people to do the enforcement. As we see, the police, the radar, that the only example I pulled back. Budget is a reflection of our values. When we see the cuts are coming here,
Gentleman's
I
time
just
has
asked for the
expired.
amount of
Thank
time
you.
that you gave the other
Gentleman's time has
gentleman.
expired.
So
Thank
I
you
just
very
say we
much.
give the
We'll now
same
recognize
amount to our
Dr.
other
Fox for
people
5
to be
minutes.
treated fairly, which
Gentleman will
obviously
suspend.
you don't
The
remember
gentleman will
this.
suspend. Thank you.
Enjoy your few
Dr.
days.
Fox is recognized.
Thank you, Mr. Chairman. And I thank our witness for being here. Chairman Good and I asked for a report listing outstanding EBSA investigations based on the day each investigation was opened. We made this request by letter dated September 19 last year, and again by letter dated November 2nd. On December 14, 2023, this committee staff asked your Deputy Assistant Secretary, Ali Kawar, for the same report, yet your staff has still not produced that report to the committee. Why have you refused to produce that report to the committee?
Thank you, Chairwoman Fox. It's nice to
Can
finally...
you pull your mic up a little closer?
Certainly. Apologies. It's nice to finally meet you in person, and I wish you a happy advanced birthday, since you're the only one that has a close birthday, I believe, on the committee. With respect to our investigations, we feel that we have been responsive to all of the requests and information that has been asked of us.
I'm sorry. You may feel one way, but that's not evidence. Why have you not produced the report, and will you commit to producing it within 7 days of this hearing?
We have provided, Congresswoman, and Chairwoman, we have provided much information regarding the investigations, including metrics, and we're committed to continue to respond and to address any additional...
I need a simple answer. Will you give us that report, which we first asked for September last year?
Congresswoman, I would commit to continuing to work with your staff on any additional information that you have not received.
Okay, so the answer is no. Last year, the Labor Department submitted an amicus brief in the case of Pharmaceutical Care Management Association versus Mulready. The brief suggests that ERISA, which is the linchpin of multi-state group health plans, does not preempt state regulation of health plan administration. Why did the department take this position?
Congresswoman, thank you for that question. With respect to preemption, ERISA preemption, it can be a very complicated and fact-specific question, and there was litigation on that where we took the position that under those specific circumstances, that was the result that the department took. Again,
Okay, you're saying that ERISA is very complicated. ERISA preemption is very complicated. Hasn't been complicated for a long time. It's only since the Biden administration that it appears to be complicated. So will you fully commit to fully defending strong ERISA preemption moving forward?
Congresswoman, I can commit to working together with the department and with the Department of Justice on fully evaluating any case that comes before us that involves preemption and determining whether in that specific case, position by the department either advocating for preemption or indicating that preemption is not appropriate under those circumstances would be appropriate. But it's difficult to answer without knowing the specific facts of any future case. Preemption is not always the way.
I have one more question I need to ask. There's bipartisan consensus on the need to boost mental health care in this country. However, the administration's recent rule on mental health parity adds more burdensome regulations, raising costs for patients and reducing access to mental health care. How much does the administration estimate that premiums will increase under the final rule?
Thank you, Congresswoman, for that question. I do not have in front of me exactly the amounts on any increased costs.
Then we'll ask you to give it to us immediately. Since you have it but don't have it in front of you, we'd like to have that by the end of the day. How will stakeholder comments be reflected in the final rule?
Thank you, Chairman. We have considered all of the comments that were received, both for and against the rule, and they will be addressed in the final rule when they are issued.
And what's the timeline for releasing the final rule?
Congressman, I cannot say exactly the timeline, but I can tell you that it's a high priority for the administration.
Thank you, Mr. Chairman. I apologize for going over. I yield back.
Thank you. Pursuant to the previous order, the chair declares the subcommittee in recess, subject to the call of the chair for votes on the House floor. We will reconvene immediately following the last vote of the series. Thank you. The subcommittee stands in recess.
pissing me off. It was in the frame.
The subcommittee will reconvene and come to order following our recess. I now recognize Ms. McBath from Georgia for 5 minutes.
Thank you, Mr. Chairman and Ranking Member DeSaulnier, and our witness, Assistant Secretary Lisa Gomez. Thank you so much for taking the time to come before us this morning and making this hearing possible. Assistant Secretary Gomez, earlier this year, my colleague, Congressman Rick Allen, and I sent a letter to the Department of Labor highlighting the concerning practice of alternative funding programs run by alternative funding vendors. In a 2023 survey conducted by the Kaiser Family Foundation, 164.7 million Americans had employment-sponsored health insurance. Employers who choose to fund their own health insurance plans are responsible for providing their employees with affordable and accessible health insurance. As employers and employees continue to grapple with the soaring cost of specialty drugs, alternative funding vendors have found a loophole that keeps costs down, but actually it's at the price of the patients, their health, and their access to medication. Under the guise of saving money, these third-party vendors are pushing employers toward health plans that exclude specific specialty drugs and are steering beneficiaries towards patient assistance programs that are meant to help the uninsured. Directing beneficiaries towards these charitable patient assistance programs does not actually guarantee coverage of specialty drugs, and oftentimes these patients must shoulder the full cost of life-saving medications or experience delays that can result in harmful and long-lasting implications and complications in their health. Healthcare is very personal to me. I'm a 2-time breast cancer survivor, and I was lucky to have really good health insurance and coverage that kind of helped bear the expense of the life-saving treatments that I needed that I otherwise really couldn't afford. I know what it's like to navigate the complicated healthcare system as a patient. And when you get a diagnosis, your mind just kind of spirals in all kinds of directions. You have 1,000 questions. How much is my treatment going to cost? What are my treatment options? And how soon will I start my treatment? And how can I afford this? And the list of these questions goes on and on and on. Facing an illness is stressful enough as it is, and I can only imagine how devastating it would be to be told that we will have to delay your access to a life-saving medication or will not be able to cover the treatment that you need. I worry that this emerging practice will exacerbate a healthcare crisis that we already have in America, one that leaves patients to their own devices, pushing them to navigate a complex payment system alone, or forcing them to choose between a life-saving medication that they need and keeping food on the table. And when we play middlemen in personal decisions made between patients and providers, we risk what matters most. So our workers deserve better. I really believe that. And our patients deserve clarity, and our constituents deserve affordable and timely access to health care. Let me ask you, does the use of these alternative funding vendors cause concern that patients will lose access to care or experience delays that could worsen their symptoms?
Yes, thank you so much for the question, Congresswoman. And also thank you for both you and Congressman Allen's interest in this topic, which is a growing issue for the department as well. I wanted to just mention, I so appreciate you sharing your own personal experiences, and if I could take a point of personal privilege to just mention that we have benefits advisors across the country who help steer folks like you who are having issues with their medical coverage and have questions. And I'm proud to say that we have one of our benefits advisors from our Atlanta regional office who was very excited to see you in the audience today, and she's here with us today. So I wanted to just highlight.
And just so you know, I have one more question to ask.
Oh, sure. So I'll be quick. On your interest in this issue, these alternative funding programs are service providers who are going to employers and telling them that they will be able to save money on these high-cost specialty prescription drugs. We appreciate you bringing what you and your staff have learned on this, and employers find that these programs are not what are being sold to them, and more importantly, participants find that. And so we are working on that and continuing to work on that, and looking forward to working further with you.
Thank you. Does the Department of Labor have the statutory authority to address this issue?
Yes, thank you. We do have the statutory authority to address this issue with respect to the plans that are
Time has
offering these
expired.
programs.
Thank you very much.
Thank you.
And
Now-
we'll continue to work with you.
Thank you.
Thank you.
Now I recognize Ms. Manning from North Carolina for 5 minutes.
Thank you, Mr. Chairman. Assistant Secretary Gomez, I want to thank you for taking the time to be here with us today and share with us the important work of the Employee Benefit Security Administration. Outside of purchasing a home, investing retirement funds are often the largest single financial decision Americans make for themselves that will impact their future. And many people turn to trusted advisors to provide sound advice. However, these advisors are not required to provide the best possible financial advice to their clients, and that's something that most people don't know. And when they learn it, they find it extremely alarming. I was pleased to see the EBSA attempt to correct this through the Retirement Security Rule. The Retirement Security Rule would finally require financial professionals to put their clients' interests first when they advise retirement investors. What is the impact, in your experience, of having conflicted advice coming from a financial advisor? What's the impact on consumers?
Yes, and thank you, Representative Manning, for that question. The Retirement Security Rule is a tremendous priority for us because, as you mentioned, individuals who are looking for recommendations for retirement advice should be able to trust that they are getting advice from someone who is acting in their best interests, is not going to overcharge them or misrepresent to them, and that they are giving prudent advice. And when we looked at how this could affect savers, the numbers were really staggering. And these are studies not only done that we've looked at, but independent entities who have looked at it. And we are talking about the effects of having conflicted savings. If we were able to eliminate this, which we hope to do that through the rule, we are looking at billions of dollars over 10 years. If I could just give you the numbers, we are looking at some studies that are showing increases of $55 billion in fees, in savings of $55 billion in fees over 10 years. And in just certain products, fixed annuities, those savings amount to $32.5 billion. So this is real money for real.
So we know that opponents of the Retirement Security Rule are trying to force this body into rescinding the rule through Congressional Review Act resolutions. What would the impact be if this policy were reversed?
Yes, thank you so much for raising that. If the policies were reversed, and if a CRA resolution was successful here, we would not be able, we at the Department of Labor would not be able to regulate in this area, or would be severely limited in regulating in this area going forward. So we would not be able to protect, and folks and retirement savers would continue to be subject to not knowing what they're getting when they are going to these professionals.
So one of the arguments against this rule is that low and middle income retirement savers will lose access to investment advice. And we heard similar things when the SEC implemented its best interest standard and no access problems actually arose. We also heard similar things when the Obama administration finalized its more expansive fiduciary rule in 2016. During the short time that the expansive Obama-era rule was in effect, did we see any credible evidence to show that low and middle-income retirement savers actually lost access to advice?
Thank you for that. This rulemaking shows, requires that people provide better non-conflicted advice.
But did
And
we
as
see
you-
any loss of access to advice in those two instances I just asked about?
We did not see loss of access, and in fact, there was better advice being given.
Okay, and is that something that has been documented that you can provide to us?
We have in our retirement, in our regulatory analysis, there is information on that, and so we can provide that.
That would be great. I would like to see that. And my time has expired, is about to expire. With that, I yield back.
Thank you. I'm going to, before I recognize Mr. Burleson, I'm going to ask the witness to please refrain from thanking us for the questions, saying our names and that sort of thing. Just get right to the answers so that we can utilize the time the best of that it's allotted, or else I will just add time to cover for that delay tactic on answering questions, please. Mr. Burleson is recognized for 5 minutes.
Ms. Gomez, on Monday, your office sent the final report, I think it was long expected, on the Interpretive Bulletin 95-1 for pension risk transfers. Now, Congress had required that in Secure 2.0. How late was that report?
The 95-1 report was had a due date of the end of December of 2023, and so we did our best to meet that, but we were not quite on time.
So about 6 months late. Would you think that after all that time, you'd be ready to modernize the standard to make sure that retirees can count on their retirement benefits? Because while you laid out the reasons why the standard should be updated, you still didn't actually modernize the standard. Do you have a timeline for that?
Just to go back one moment, we were requested by Congress to review our interpretive bulletin and determine whether or not any changes might be warranted without actually making changes. So we have decided to look at changes through notice and comment rulemaking, and I don't have an exact time frame as to when that would happen, but we intend to engage with the public so that we can have full input from the public as to what will work best.
In April, the White House, this is a different topic, the White House held an event with a group of, quote, asset owners representing $1 trillion in public and pension fund capital. At this event, union leaders and were able to promote strong labor commitments among funds and that the asset managers were investing in. So thus diverting pension funds to promote collective bargaining, which it goes against the statutory protections for pension funds that are subject to ERISA, which mandates the funds be used exclusive for the exclusive purpose of providing benefits to participants. In other words, it's not for the purpose of being politically active. Ms. Gomez, what are you doing to prevent the improper use of pension funds, such as what the White House is doing to basically politicize these retirees' funds?
Yes, so under our prudence and loyalty and plan investment rules that was issued at the end of 2022, we were very clear as to whether and under what circumstances fiduciaries of ERISA plans could consider any type of environmental, social, and governance factors in making investment decisions. Of the meeting that you speak about at the White House, there were several different types of plans participating. They were not all ERISA plans that are governed by our statute.
So you issued a rule that allows them to use ESG as a standard when investing in funds.
So we issued a rule that made clear that fiduciaries may, under no circumstances, subordinate the interest of participants and beneficiaries in their financial plan benefits, and they may, under no circumstances, sacrifice investment return or take any additional investment risk. They may, however, take into consideration certain factors and certain environmental, social, and governance factors, and if they investments that consider those factors will equally serve the participants, then they can consider them, but they are not required to.
As a former advisor, I find it puzzling that you would even need to do that. I think making that statement is steering advisors in the direction of taking their clients' funds or the pensioners' funds and becoming politically active with it. I as someone who used to manage retirees' funds, I would never, ever consider trying to apply my political views to someone's retirement. When you're sitting across the desk from someone who is asking the question, are they going to have enough to retire? Are they going to run out of money before the end of their life? The last thing you're thinking is, how can I make sure that their funds are funding some social justice cause or climate cause? Thank you. My time has expired.
Thank you. We'll now recognize Ms. Jayapal for 5 minutes.
Thank you, Mr. Chairman. The Employee Benefit Security Administration has the important mandate of enforcing employer-sponsored benefit plans, ranging from health to disability to pension plans. And I want to start by congratulating you, Assistant Secretary Gomez, and the EBSA for your agency's work to restore $1.4 billion, billion with a B, back into the hands of workers, retirees, and their families who are simply asking to receive the benefits that they are paid for and entitled to. The work you do is critical, but I do want to be clear, most of these problems stem from corporate greed and our broken for-profit healthcare system. I am the proud lead sponsor of the Medicare for All bill in the House of Representatives because it is long overdue to guarantee health care as a human right, as most of our other countries in our income brackets do. Private health insurance companies, motivated by profit, raise already exorbitantly high premiums while simultaneously lowering patients' standard of care and arbitrarily denying coverage. In the richest country on earth, no one should be denied access to care or have essential care delayed. It's unfortunately no surprise that my Republican colleagues have convened this hearing to attack an already underfunded agency that puts billions of dollars stolen by private insurance companies back into the pockets of everyday Americans. I wish we could be working together to ensure greater access to quality care and making sure that EBSA actually has the resources it needs to ensure that Americans get restitution when their private health insurance company illegally denies coverage. So, Assistant Secretary Gomez, what are the most prevalent issues that you are seeing people face with private health plans, and what tools does EBSA have, or what tools does EBSA need to address those issues?
Yes, thank you for that, and thank you for advocating for coverage for folks everywhere. Our mission is to protect the health and retirement coverage for all workers, and so in whatever form that may be, but currently we're working with the employer-sponsored health system. As you've pointed out, we at EBSA oversee all of the employer-sponsored health and retirement plans in this country. With respect to health plans, we're talking about 2.8 million health plans across this country, covering, all of our plans cover about 153 million workers and their families. And with only 850 employees at EBSA, with a relatively austere budget, and we have about less than one investigator for every 1,300 plans that we oversee. So there are a lot of opportunities for bad actors to be slipping through the cracks. And, try as we may, there's only so much that we can do. We do have a very comprehensive enforcement strategy, and we try to be mindful about, given the small number of folks that we have that are enforcing the law, how we can best do that through looking at the cases where we'll be able to have the most effect. But even given that, we can't possibly get to everyone out there and be able to protect everyone as we would like to.
Yeah, you really need more funding to do that important work. And I just want to be clear about what a worthwhile investment it would be to invest in EBSA. With the amount of money that EBSA recovered for taxpayers in fiscal year 23, your agency paid for itself more than 7 times over, more than 7 times over. Can you talk about the unique value add of the EBSA for Americans on employer-sponsored pension plans and how inadequate funding for EBSA impacts your ability to deliver benefits?
I would be happy to, and thank you for the opportunity to do so. We have a really great, but I've found little-known service that is available to American workers and their families that allows anyone to be able to call upon our benefits advisors. We have 130 benefit advisors across the country who are available just by going to our website, ebsa.dol.gov, or calling our, I sound like an infomercial, but calling us at 866-444-3272. I'm proud to have one of those benefits advisors with me today. And anyone can call and ask their benefits and be able to get assistance. And if you'll allow me to just give one example from your state, there was an individual from the state of Washington who contacted a benefits advisor looking for help trying to get retirement benefits from an old employer. And he was a union worker who was 71 years old, should have been receiving benefits since age 65, and the benefits
Gentlelady's time has expired.
She's in the middle of her answer, Mr. Chairman. I asked my question before my time expired.
Gentlelady's time has expired. We'll recognize Mr. Scott, please, for 5 minutes.
Well, thank you so much for your incredible work on behalf of workers. I'm sorry that the chairman won't let you finish your answer about exactly how you've been putting money back into the pockets of people across this country. I yield back.
It was a good result.
Well, I'll let you finish and tell the rest of the story about the gentleman from Washington.
So we were able to find, thank you, Congressman, we were able to find the previous employer and connect him to this pensioner, and he was overdue for a pension about $398 a month.
About how much?
I can tell you many stories like
About how much?
$398 per month that just that one person received.
Well, thank you. You indicated you had 2.8 million plans. Is that, and 153 million people. Do you have time to proactively advise like small businesses on how to set plans up?
Yes, we have 2.8 million health plans, so those are only the health plans, not the retirement plans. But we do definitely make time to, in trying to increase retirement access to all. Our outreach and education group meets with small businesses. We have put together publications for small businesses to try to encourage employers who would be interested in setting up these plans, what they need to look for and how we can help.
And when people call in, are they able to get people on the phone with the staff you have?
Yes, we have people who are available by phone. Those folks are very stretched since there are so few and we're trying to help so many. But we do help both participants and employers with questions they have.
Now, your agency reversed the Trump rule that expanded associated health plans. What's wrong with associated health plans?
Well, thank you. There's nothing inherently wrong with association health plans. However, and we had guidance for many years on what factors could be considered in determining whether an association health plan could exist under ERISA. In the 2018 health plan rule, broadened those requirements so that employers who had a more tenuous relationship with each other could form an association health plan. And in doing so, they would be subject by ERISA, but they might not be responsible, they might not be subject to the requirements under the Affordable Care Act for individual and smaller health plans that were more strenuous.
And isn't it true that if you expand these associated health plans, everybody else on average would end up paying more if they pay less?
That is exactly right.
Do some of these things become insolvent?
Yeah, it's quite possible that some of these plans could become insolvent and that it would affect the individual and small group health plan systems.
And do these plans have the consumer protections like minimum benefits and the right to appeal and that kind of thing?
The association health plans have certain protections, but they are not as strenuous as the protections that would apply to the individual and group health plan market.
With ESG plans, it's my understanding that they are just part of what a employee could pick. They're not required to have that plan. Is that right?
That's correct.
And is it true that when you consider environmental, social, and governance considerations, that many of those plans actually do better than other plans?
Yes, that's correct. And we were in fact hearing from the market, from the investment market, that they were looking for additional flexibilities so that they could, if they wanted and decided it was in the best interests, consider those types of factors for that very reason.
And isn't it true that you can only do those to the extent that you do not diminish the value of plans for the consumers?
Correct. They need to consider both the investment return and the risk return on those types of investments before doing that.
On your fiduciary rule, you made it clear that the advice has to be in the best interest of the consumer. What kind of rip-offs occur when you don't have that arrangement?
Yes, so when you do not have that type of arrangement, and investment professionals are allowed to put their own interests above the interests of the consumer, there are savings lost to the tune of billions of dollars.
And a lot of this could be overcharging. You could provide a service at a higher fee than
diminished returns.
Than what other things that are available on the market. Thank you, Mr. Chairman.
Thank you, Mr. Scott. We'll now recognize Ms. Hayes for 5 minutes, if you're ready.
Thank you. Thank you, Assistant Secretary Gomez, for your testimony today. According to data published by the U.S. Census Bureau, about 86% of U.S. private sector employees work for establishments that offer employer-sponsored health insurance. Data from the Bureau of Labor Statistics show that 73% of civilian workers had access to retirement benefits as of March 2023, with 56% of workers participating in those plans. Put simply, a majority of Americans rely on employer-sponsored plans for crucial benefits and to ensure a strong retirement. I do not believe any member of this committee would dispute that health insurance and retirement can be difficult to navigate under the best of circumstances. Assistant Secretary Gomez, I want to discuss some of the work that the Employee Benefit Security Administration does to protect workers and retirees. Most people are probably unaware that EBSA employs benefit advisors at its regional offices to assist in underlying misconduct or help workers and retirees navigate their plans. In Connecticut, an EBSA benefits advisor was able to help a retiree access nearly $2 million in retirement benefits from a former employer. Assistant Secretary, what policy changes can Congress enact to increase access to services like this for our constituents? And additionally, can you provide the perspective of a benefits advisor on how these policy changes could improve outcomes in other cases?
Yes, thank you for the opportunity. As far as policy changes are concerned, we do have, there are several areas in which we do not have sufficient teeth in our laws that we enforce, including civil monetary penalties that are not available for violations. There's an inability to enforce the law with respect to service providers who are not subject to the law, to ERISA, and so several people who are involved, we just don't have enough power, enforcement power, to be able to most efficiently administer our laws. Separate from that, from a funding perspective, we are, as I've stated before, a minuscule agency compared to our responsibilities, with only about 850 employees. The benefits advisors that you speak of, we have 130 across the country. The amount of calls that they get in on every single day, and these are emotional calls with people calling up because they need a transplant, or they are missing their pension, or they can't get a call back from their health coverage. And it's a lot to ask of 130 people who are answering phones for so many people, and they are so committed to their jobs. So again, with additional funding to be able to add to our staff, that would be incredible in how we can serve. Instead, we are faced with funding, with cuts in our funding, and specifically, aside from a cut in our funding, we have supplemental funding that was given to us under the Consolidated Appropriations Act that is specifically directed to enforcing the No Surprises Act, which protects, again, 1 million claims a month, saving people from surprise bills, as well as in our mental health enforcement, which is saving people every single day. And we are set to lose that funding at the end of this year. And losing that funding, rather than being able to increase our team, will force us to attrit almost 120 employees. So we're in a very bad situation, and very worried about that.
Thank you. I didn't want to stop you. Although I have other questions, I wanted to hear that because it's all very important information. In February, this subcommittee held a hearing on the Biden administration's proposed retirement security rule, and one of the witnesses testified that as many as 97% of savers believed that their financial professionals were their fiduciaries, meaning every decision they made was in their best intention, and we found that not to be true. Unfortunately, that's not always the case, and many people who are working hard to save their retirement end up receiving conflicting advice, and it's too late by the time they realize it. I'm going to submit a question for the record that talks about the retirement savings lost and found in Secure 2.0 that we fought really hard to make sure that was in there, and just really ask that you provide information on how EBSA is making important changes to meet the goals of that initiative, so that people who think that they're saving for retirement are in fact saving for retirement. I'll submit that question for the record. Thank you for your time today. With that, I yield back.
Thank you.
Thank you. I'll now recognize myself for 5 minutes. Ms. Gomez, EBSA oversees retirement, health, and welfare plans benefits for 150 million plus workers, retirees, and their dependents. What is EBSA's top priority?
We have several top priorities. Our top priority is to make sure that we are serving on that mission.
Well, let me stop you for a second. In your testimony, you said EBSA's top priority is the EBSA's top priority is the Mental Health Parity and Addiction Equity Act.
Yes, that is our top priority on the health side. I left the word health out, but yes.
I mean, if that's your top priority, what does that say about your focus or lack thereof on the massive scope of your other responsibilities that affect 150 million Americans, or the nearly 14 trillion assets for which you have oversight? To say that's your top priority, I thought that was just very interesting. I understand that's very important, but to say that's your top priority. With Democrats, it's always about the money and more funding. How many of EBSA's 800, you've mentioned several times, hey, we've got 850 employees, and one of the members on the minority side was bemoaning that they said somebody wants to cut 14% of the workforce of EBSA. How many of the 850 employees actually report to work in person every day?
Currently, the Department of Labor's policy is...
I didn't ask about the policy. How many EBSA employees actually report to work in office every day?
I do not have that information.
What would you estimate the percentage to be of the 850 employees, or the number of the 850 employees who report to work every day at an office?
Our policy.
Okay, I want a number.
Yes.
I want a number or a percentage,
I do not have
please.
A number for you today.
Okay, you should be able to ballpark it. You supervise these 850 people. How many of them come to work? You have no idea. Are you telling us today you have no idea how many of the employees come to work at an office, report in person every day?
All of our supervisory, non-bargaining unit
I'd
employees.
like this question to start with a number or a percentage of an estimate. I'm not going to hold you to the exact number. You can be approximate here.
I do not have that approximate
You have
number
no
to you.
idea how many of your employees come to work every day at an office.
I do not have an exact number.
I didn't ask for an exact number. I asked you to give me an approximation. You have no idea. You can't even guesstimate. You don't even think you can be in the ballpark of how many come to work, report in person every day.
There is no one who comes in every single day that is
No
not
one
our
does.
policy.
Okay. How many come in, to the ones that don't come in to work every day, how many days a week do they come into work?
For our supervisory employees, they are required to come in 5 days a pay period.
5 days per pay period. So define that for folks who might be interested in pay period. That means 5 days per?
Biweekly.
So every 2 weeks, 5 days. For supervisors, how about the other 800 employees or so?
For the bargaining unit employees, the department is working with the unions to negotiate the terms of that.
So there's no requirement for the others?
There is a requirement currently for 2 days every pay period.
2 days every 2 weeks?
That is being
All right,
negotiated.
how about you personally? How often do you report to an office to work?
I report to my office pretty
In
much
person?
pretty much every day in person.
And that is where?
My office?
Yes.
I'm either in my office here at the national office on Constitution Avenue.
I thought you resided in New York.
I do not. I reside in Penn Quarter in Washington, D.C., and I go home to see my family on the weekends.
Okay. Under your leadership, EBSA repealed 2 healthcare regulations from the previous administration, which has eliminated choice for Americans who desperately want options in an increasingly consolidated marketplace. As you know, EBSA repealed the Association Health Plans rule, which permits individuals and small businesses in similar lines of work to pool together and negotiate better rates. When it was in effect, it was reported it saved these plans 29%. EBSA also repealed the short-term limited duration insurance rule, and these plans can be a lifeline for someone who loses their jobs and needs insurance to fill in the gap between positions or enrollment periods. The previous rule allowed for Americans to stay in these plans for 12 months, while the Biden rule only allows for 3 months. Many Democrats, including some on this committee, continue to push for single-payer, government-run health care, because the government does such a great job with everything. Everything always gets better when the government takes it over. Medicare for all, of course, is the dream there. The left will claim that, and they've done it today already, that anything that's not government-run health care is junk insurance. You know, that employers and employees can't choose for themselves. Anything that doesn't provide full coverage, because that's, you know, everything's better again when the government runs things. So given your role, you're a steward of employer-sponsored health benefits. Will you commit to opposing Medicare for all?
I do not have enough, that has not come before the employee.
Are you opposed to Medicare for all, or do you support it?
That is not, I think, a part of the priorities.
You can't answer that question if you oppose it or support it.
I am not.
Thoughts never occurred to you before.
I did not say that, but
Okay.
that
All right,
is
thank
not
you.
part
My
of
time has expired. I'll recognize our ranking member, Mr. Saulnier, for 5 minutes.
Thank you, Mr. Chairman. Thank you, Ms. Gomez, for being here. As has been said, you have the responsibility of protecting the retirement and health benefits for 153 million Americans, almost half of the population, with up to $14 trillion in assets. No small job. And in terms of always throwing money, I don't agree with that, Mr. Chairman. As a former small business person, I believe in efficiency, and I think we should have a commonality. But sometimes you have to spend money to make money, and in this instance, you have to spend money to get good people to enforce the laws. Unfortunately, there's been a very aggressive attempt, and it reminds me of the mortgage industry 15 years ago, by some health plans to just blanketly deny medical claims and behavioral health claims, even worse. The Kaiser Foundation has estimated that some plans reject 90% of the claims. I've had individual doctors talk about how for years they've put the same claims in, and now they don't have the staff to constantly call and help their clients. ProPublica found that Cigna actually had constructed a policy where they would just, their doctors, Cigna's doctors, would blanketly refuse claims without even opening the patient's files. So on the medical side, you already mentioned this, you don't have enough regulators to enforce the laws, and the good health plans have to decide whether they're going to maintain their profitability, even though they do follow the letter of the law and with integrity and confidence for the people, the employers and the employees. but the bad actors are driving the market to the bottom, like the mortgage industry. So could you add anything to your observation that it's not just the risk assessment by these bad actors that they're not going to get caught because they're having some friends here on the Hill complicit in reducing the oversight, the literal cops on the beat, but they're also the disincentives, whether it's a private right of action or fines, that people know there's very little consequence for them financially or personally by ignoring the law and just denying claims blanketly.
Yes, thank you, Congressman, for that. A couple of things. First, we certainly do not have enough people on the beat. As I mentioned, the incredibly underbalanced, whack of balance ratio between what we can do. And so we know that we are not possibly getting to all of the bad actors out there. And so there are many who know it's very unlikely that they will get caught. And unless someone contacts us and knows to contact us and tell us that there's a problem, that could very well happen without additional resources. In addition to that, because we have very limited authority to do something once a plan is violating the law, we can't do much other than require them to correct that and pay the benefits, which might just delay the process and in some cases be detrimental, financially detrimental, or could be cost a life if someone's delayed treatment. So we need additional enforcement powers so that we can really put teeth in what we're doing and be able to get to everyone.
Let's switch to behavioral health. George W. Bush signed a landmark Parity Act, and since then, as many as 3.5 individual people applying for behavioral health under their health plan, which they've paid for and is required to be equally distributed under the Affordable Care Act and George W. Bush's signed legislation, we know that they're being denied and ignored. 3.5 times they have to go outside their plan even though they've paid for it. This is in an atmosphere where there's been a 300% increase in requests for behavioral health in this country since the Affordable Care Act was passed, but a similar decrease in the number of people going into the field. So in addition to all that, the people who want to go into this field, there's no business model for them to get the return on investment to get a bachelor's degree, a master's degree, or a doctorate degree. So this just seems to be willful, and as you said, the ripple effect on the mental health and trying to break that tendency. The Surgeon General just issued a warning about social media and what that's doing to young people. We know that adolescent girls have been attacked and there's a high rate of suicide rates. How do we enforce these laws when there's no real enforcement mechanism to the bad behavior by some of the health plans, even though they're required by law to provide these services?
I appreciate the question, and I honestly wish I had an answer to that, but unless we have additional resources, we simply will not be able to do that.
Thank you. I yield back.
Thank you, and I'll now recognize Mr. Saulnier for his closing remarks.
Thank you, Mr. Chairman. Certainly this is a good hearing, and I think it's exposed some of the challenges, and as someone who does not believe throwing money without accountability, particularly on things that risk Americans' lives and their families' financial health and their behavioral health and practices, and the exponential crisis we are in, particularly on behavioral health and cost, I would really think that we would keep our eye on the ball and not just spend money for the sake of spending money, but spend money where the cost return to American consumers is justified. And in this case, it's clear to me, and our message is to the investment community that is doing this, clearly is a green light to let them continue. And for the good providers who want to provide good services, it's an admonition that if they play by the rules, they're going to be punished, which I think is a sad state on this committee and this Congress. The ERISA Advisory Council recently released a report on improving long-term disability benefits. And the council found that 99% of long-term disability plans impose duration limits for people with disabilities. So in addition to the behavioral health and the medical health, then people most vulnerable with disabilities also get attacked. So all of this is to say, in my closing comment, we have a lot of work to do. And it is my hope that we support your efforts and the administration's efforts, and in a bipartisan way, because this is a return on investment in people's lives, Americans' lives, and the quality of their lives. And the absence of that, as you have said, is people will die, and they will suffer, even though they have paid into these plans. Thank you, Mr. Chairman.
Thank you. Now I recognize myself for closing remarks. Ms. Gomez, thanks again for coming before this committee and answering questions. Unfortunately, I'm even more convinced after this hearing that EBSA has woefully misguided priorities that distract from its intended mission of protecting the financial health and security of millions of Americans. It appears you're more interested in expanding EBSA's regulatory power than in faithfully executing the laws. We've heard today about the negative consequences of repealing healthcare regulations and advancing the fiduciary rule and ESG rule. The last thing the American people want or need is an agency that will push forward policies that courts overturn and aren't popular enough to pass Congress, the American people's representatives who are supposed to make law. Instead, bureaucrats should focus on providing helpful customer service, which would be better served by in-person work, by the way, and faithfully administering the law. But sadly, it seems that EBSA has abandoned its important duties like providing timely investigations of the benefit plans it actually has a responsibility to oversee. It's also important that our agencies demonstrate the highest level of integrity in their work. Improper payments to pension plans have obviously destroyed that notion. I'm also confident that EBSA, and more importantly, the American people that you are supposed to serve, would benefit from your workforce actually coming back to in-person work. It's certainly concerning that you said a few moments ago that your employees are negotiating essentially against the American people regarding the requirement to coming back to in-person work. Perhaps they will show up in person to protest coming back to work, as the Boston Department of Labor employees recently did. You say that again. They showed up in person to protest having to come back to in-person work. Your agency certainly has its work cut out for it, and this committee will do everything possible to hold you accountable. Without objection and there being no further business, this committee stands adjourned.